Hello and welcome to VistaTalks, interesting discussions with interesting people from all around the world. I'm your host for today, Simon Hodgkins, and I'm really delighted to be joined by Martin McCormack. Martin is a distinguished leader in healthcare. He's currently serving as the Chief Executive Officer of the College of Anaesthesiologists in Ireland. His expertise extends across governance, digital transformation, and of course, AI in healthcare, something no doubt we'll be touching on. He holds several influential roles, including he's a member of the HSE Board Technology and Transformation Committee, and he's also an adjunct professor at Trinity College, Dublin. So that's a lot, Martin. Congratulations and welcome to the show. It's good to have you here.
Thank you, Simon. I'm delighted.
Let's get straight into it. Martin, with your extensive experience, obviously in leadership and governance and healthcare, and this changing landscape that we find ourselves in, can you maybe share some of your insights on how you lead organization and cultural change in that sector? I'm thinking of things like, pre, during, and post-pandemic. That was a lot of change for everybody, but also maybe effective governance, strategy, execution, and what do you do in times of challenges or times of change? So over to the expert.
Simon, thanks a million. I suppose I like to keep things simple. And for me, governance or good governance is around best decision making that you can. So I see, just keeping it very broad, I like to see where I can add value is helping people, to make decisions, better decisions. And it's interesting as a CEO, you really have to accelerate your decision making yourself. So over time, you learn how to make better decisions, what type of information you need, the critical framework you need to analyze it and that as well. And leading, and I take a great responsibility for the culture and organizational change as we try and deliver that ambitious strategy, no matter what sphere we're in. But you talked about challenges. I guess for me, one of the biggest challenges has been managing the rapid pace of change, while we still make sure that we're aligned with stakeholders that we bring along with us. And the pandemic, it really exposed gaps in decision making in every sector. Health wasn't immune to that. It forced leaders at every level to make high stakes. Patients' lives were at risk here quickly. So effective governance for me, it means, and it has always meant, you need to balance transparency, but you need to be decisive. You need to make the decision. You need to keep people informed, the people who are working on the front line, the board. Everybody needs to understand the rationale behind those decisions. I don't need to be here for the organization to continue to make decisions. So you need the board support, you need a strategic vision, but flexibility to be able to deal with whatever's happening as you go along. So that's definitely where I see some of the changes. But over, I guess, in terms of the bigger question, then in relation to governance, maybe resilience, that organizational resilience or strategic resilience that came up, it did throw up if we look across the globe and we look at the different responses. And it might not be the pandemic, it might be political situations in different countries, it may be other inflationary costs, supply chain disruption that has happened. I guess some of the hallmarks of good governance, I translate it every day back into patient safety and what does it mean for safer patient care, quicker, safer patient care at the right time. So I guess for me, the hallmarks that I try and nurture are policy capacity. Are we working as part of a collaboration, the department, the government, the operating wings? Do we understand how policy is initiated, the evidence base for that, how it gets translated? Is it implementable? That's one. The second leg would be integrity. Do people believe in us? Do they trust in us? How do you develop that, particularly with the regulator, the politicians, postgraduate colleges, different stakeholders? The next element would be accountability. So are we all held accountable for our actions, and how do we build that in? too often I see strategies without measurable outcomes in them. So how can you bring people along if they don't know where they're going? And then essentially the fourth aspect of that, it just covers all, that's the transparency around this. So am I open to being questioned about? Yes, absolutely. Is it clear? Should it be clear? Yes. And I think that consistency is a hallmark of good governance, that you know that this is how we'll approach making a decision, that there is fairness and transparency around that. So I guess they're all the things that we're only under the microscope a little bit more during COVID. And for me, I guess one of the challenges as I think back to the early days of COVID, so you pointed at the start that I'm based here at the College of Anaesthesiologists. So for people who aren't familiar with what is an anaesthetist or what is their role, well, in Ireland, we have one of the best training programs in the world. So we have an enhanced training program for anesthesiologists. So that means we train anesthesiologists here not just to work in the operating theatre, but they're also trained in intensive care medicine and pain medicine. So from the perioperative pathway, keeping people well, right up the day procedures, monitoring the little neonate just born with acute problems, right up to, the 98-year-old who requires care. So we deal with that full spectrum. And you can imagine that when COVID happened, we had so much evidence coming at us, and some of it wasn't from a very good base, and we had to filter that, provide it out, provide leadership advice to the government as to what we should be doing, how we should be doing it. We were advising and supporting the health service to move people from centre to centre, mapping where the pandemic was happening, working with the doctors in training who were brilliant, international doctors who were working here and stranded here, trying to work with people to create and continue that camaraderie and consensus, and try and work and keep an eye and a focus on patient safety. So I guess we've had that experience, and the beauty of doing what we do and the honor of doing what we do. So we're a registered charity as well as being a private organization. So anything that we do, we're not for profit. Anything that we do, we put back into our charitable outreach. So we have very strong partnerships across East and Southern South Africa, and a range of colleges there through a partnership that we have with the colleges over there, and we try and impart our learnings, and they're adapted locally, because if what has all this taught us, I mean, if you keep it all around what is our motive, what's our passion, it's all around improved patient care. And we know that we're lucky. We're in the 5% of the world who have access to safe care. 95% of the world don't have access to safe care. So we have to go out there and help people be able to have greater access to care.
That's great. And thank you for sharing that. I was particularly interested in your views as well, where you were talking about, key things like transparency and accountability and that word trust. And I think that was vital, and remains vital to this day. And also thank you for sharing some of the great work that you're involved in. I suppose it brings me nicely on to the next thing I'd like to ask you, which is about when it comes to overseeing the transformation, whether that's from a digital or a technology perspective. There's an awful lot impacting healthcare now around the world, particularly when it comes to healthcare education, healthcare technology, healthcare service delivery. And I'm interested in your thoughts from your viewpoint about maybe the future of digital health. We hear that word a lot these days, don't we? And especially, I suppose, because, you work with the HSE, and of course you work there with CAI. Just a few thoughts on the impact of healthcare education and service delivery would be great to hear.
Great. Yeah. So I suppose Technology, it's not an understatement to say that technology has revolutionized healthcare education, as well as healthcare and an enabler of healthcare. So we'll get into what is digital health in a minute. But I suppose your first part there was around healthcare education. I wish I could bring you in here and show you how we train doctors in a highly simulated environment before we let them out into talking to the real patient. So we've simulation-based training here. And I like to describe it to people like PlayStation. You know, if you've got your robots, you've got your mannequins, we've got the ward scenarios. It's high fidelity, so that means it's very like the situation. And we make the robots, you know, have acute episodes and care. Somebody might be having a baby and then they're having difficulty breathing, and you're putting people through that all the time. But we think of where that came from. So you started off with, you can imagine what that looked like in the 1980s, 1990s. It has absolutely revolutionized where we are now. So you've got the technology. Now on top of it, we've got online platforms. So we can link in with all of our teaching centers all around Ireland at the same time. We can be focusing on a case. We can be looking at the monitor. We can take real-time feeds. We can see what the gas levels are. We can see what the oxygen levels are. We can see everything. Then, and this is the emerging space now, universally it has been around 8 years, the technology has been there, to the learning analytics component of that. So how do we deploy analytics and data to improve our performance as learners? And we're trying to push the boundaries here and build a national capability around using learning analytics in that healthcare education space to improve doctors' performance, healthcare professionals' performance. Imagine, you know, if I said to you, how many people, 1 in 10 people walk into a hospital today and will have harm happen to them unintentionally. So we look around the room, we think of our families, and we think of 1 in 10 people are actually going to come to harm that's preventable. Now, that's generally from a medication error. It's generally from a communication error. It's generally from an error that's, you know what, it's entirely predictable. Where did these things happen? They happen not only when people are tired, they're in a staffing resource poor situation, but also they may not know about how they make decisions, how they learn, how they respond to that. And we want to break down certain areas, and that's what we're working at here, breaking down certain key areas. Like, let's take communication. So 70% of complaints to the medical council, for example, will be around communication between the doctor and the patient. So is there a right way to communicate? What are the really important times to communicate? And for me, let's look at a couple of different areas. But one, for the purpose of this, is unintended harm or preventable harm. So the communication that happens, the biggest source of something happening, a bad outcome for a patient, is and I'm thinking of family members who are sitting on a ward in a hospital, and you know what? They're going downhill. The nurse thinks they're a little bit off. They're not the same as they were yesterday. The registrar or the SHO says, you know, I think I need a cardiology to come over here. I need anesthesiology or somebody. That 30 seconds that somebody picks up the phone and communicates to the other team, there's a right way to do that or a wrong way to do it. So and that is correlated with a good or a bad outcome for that patient, how you communicate that. So what we'll do is we'll break that down. We'll break down the data. We'll break down how you do it into compartments, and we'll measure how you do it. We'll measure the metrics of you consistently doing it. Another area might be giving an injection to somebody. We'll be able to measure how you're sitting, where you sat, how you approach the patient, when you move forward, what angle you were at. the depth that you put in the injection, etc. So we're able to take that and give you feedback, performance feedback, and monitor it and help people. So for me, things like in patient safety, the real-time monitoring, predictive analytics, they all help us anticipate risks and build our education into that to intervene early. So for me, I'm excited. I wouldn't say I would adopt without the proper tools around it, but I'm really excited about the potential around electronic health records. Some of the AI driven tools that have already been deployed are really helping clinical decision making. So they don't replace it, but they're really helping. For example, during COVID, I was familiar with AI being deployed to help scan markers that have been taken in around stroke. So doctors think getting overwhelmed with lab results, the lab going crazy with COVID testing, etc. And then other people being afraid, are we going to miss something on another case? AI tools being used in stroke and in radiology. Are we looking for fractures that we haven't seen? Are we looking for stroke markers that we haven't seen? The next thing, the AI platform is able to go back to the doctor and say, out of the 9,000 cases that you've brought in the last 2 days, here's 300 people we think you need to seriously look at. Look at these results. Are you concerned about these? So I think that will really help us make better decisions, going back to good governance, but reducing human error and just improving outcomes for patients. The success, it's not just about take in the technology and adopt it. It's never been about that. It's always been, can people use it? Is it integrated into how we work? And I suppose, is it supported through ongoing training? Because training effectively, it needs to be able to support the sustainability of that.
Yeah, no, and thanks for sharing the insights, because from the robotics that you started off talking about and that real-time sort of training environment, and also the measurements that you're talking about there, and we kind of ended up in AI as well. And, you're already seeing the benefits of that coming through. And it does lead me nicely into your, I suppose, your other involvement, where I know you've been involved with the citizens jury on AI in healthcare.
Yeah.
Which is, very important, because things like ethical considerations come up. And I know AI is having tremendous impacts in the healthcare sector, but maybe just some thoughts, or maybe your views on the responsible implementation of AI to
Yeah.
ultimately improve healthcare outcomes for patient care.
Yes.
And, that sort of crucial aspects of those ethical considerations, because that must come up a lot in your world.
Oh, absolutely, absolutely. It does, and it's a nice segue from the last point around digital health into it, because too often a change will come upon us without sufficiently bringing people along with us, and things. So the link between digital health, our Department of Health and it was the Department of Health published their strategy around digital health for the next 5 years. But within that, there are 7 principles that they've adopted. One of them is patient empowerment, and the health services worked hand in glove with the policymakers to say, we're adapting that strategy, and it will be part of everything that we do. So having an empowered citizenship behind AI and being able to shape it is really important. So going back, there's a couple of different things that are happening at the same time that we need to be aware of. So I suppose the EU AI Act, it brings significant opportunities and challenges. The person on the street who doesn't know and isn't involved with European policy or that, they may be thinking about other aspects. So what we're trying to do is translate down and work with patients and citizens to make sure that we articulate and that we work, and that the citizens are able to create response that will influence government policy on AI. At a very high level, the EU AI Act, it does a couple of things. When there was a business survey, all businesses, PwC ran it in June 2024 here, and only 7% of Irish businesses came back and admitted to having a governance structure to govern AI within their enterprise. But the flip side of that is 91% of respondents believe that AI will bring cybersecurity risks. So when the Act itself says, and it enforces a risk-based approach right down. So it says that, if you're bringing in a system, you must have high levels of governance around AI. You must mitigate bias. We hear a lot about bias. You need to ensure transparency. How did you come to that decision? And you need to be able to show how you run your system of management. So I think that there's a rush around and a trendiness around AI in certain enterprises. We must have a chatbot. We must create generative AI ourselves. We must have a database. But I think that this is forcing people, going back to good governance. We need to do this in the right way. So the type of conversations that we're having with citizens at the moment is probably fourfold. One, it's asking people, think about, and this is a continuum, think about AI for self-management, you yourself, me. So wearables and shareable data. I have a watch and it tells me how many steps I walk every day. In fact, it'll tell me if I'm having a heart attack and ring my next of kin if I want to. But we need to have a conversation as a society about what do you want to do with that information? Do I want to send what's on my watch to my GP? Do I want my spouse to have access to it in the event of an emergency? What do I want? So this has the potential maybe to redefine patient-doctor relationship. The next area, I suppose, is AI and emergency care or high-risk care. And I think where the changes will come then, and we need to think about them, we need to bring people along with us. This is going back to accountability and explainability. So my point earlier on about stroke care, radiology care, etc. Where we use AI in our diagnostics, can we explain to people how we came to that decision? And can we explain if there were biases? I remember teaching in Oman and somebody coming up to me saying where what we were talking about for Western populations or where it for the female population in Oman was culturally relevant. So what biases are with it? Medications, levels, etc. What are there? So we need to be very, very clear on the evidence base for that. The third area, I guess, is more complex or personalized care. So I'll never forget in 2005. So I was working in a particular hospital, major academic teaching hospital, and I was the chief information officer there at the time. Somebody arrived in with a CD at that time saying, "This is my DNA. I want personalized medicine. I want personalized care." And that was the first time I had heard of somebody demanding for personalized care. You fast forward 20 years or so, and actually complex care and personalized care, if we're planning into the future, there's so much regulation and workforce training that we need to do to be able to deliver on that. So if we talk about screening, for example, extracting information from screening at a population base, to what extent can we do it, or is it ethical to do, etc.? And I think that the EU AI Act is actually very good in that sense. And then finally, AI and population health and public health. So how do we train machines? How do we get consent? Can we scan for future pandemics? So we take a blood test. Can we scan for pandemic X or whatever it is that's coming next? How do we address health inequalities? So these are all areas that I guess are coming up. The major ethical challenges that are being discussed in those four at the moment are fairness and equity in the algorithms. How can you safeguard patient privacy? How do you maintain transparency in how you make decisions? I guess for me, I'm really keen that if an AI system is built, that they don't exacerbate any health disparities that are there already. So we talk about public trust. It's absolutely crucial because the public need to be brought along, shape the policy, ensure that how we develop and how we deploy AI is actually in line with what we value as a society. So I think, in fairness to politicians, industry, and the advisory system that's in place, there's so many different stakeholders involved here. But I think that it does require a multifaceted approach. So you need the robust regulation and the frameworks there. You need comprehensive testing and validation of AI tools, and any company that just spins off and develops at the moment without monitoring for unintended consequences are foolhardy. Absolutely. So you do need to collaborate. You need new skills. You need technologists, you need clinicians, you need ethicists, you need the public on board. We need to, in health, obviously, we're prioritizing patient safety, data protection, equitable access. But you know what? We also want to promote innovation where we can. And we're mindful that not everybody has access to the same tools as us. So what can we share? And without compromising that human element of care.
Yeah, no, it's extremely insightful. And it is, I suppose you mentioned something there about, bringing the public along and helping them to help the wider community shape the way that rolls out. And trust came up again there, didn't it? Of course.
Yeah.
And I wanted to ask you, and you've kind of answered it to some degree, but I want to maybe just extend the question a little bit, because you've got a lot of experience and involvement at various committees and board levels that you sit on. And there's a lot of challenges and opportunities happening in the overall healthcare, life sciences type space, obviously. And you've mentioned a few things there and a few moving parts that people need to be aware of. But for organizations to better prepare themselves, to be better capable to address the challenges, maybe, because the opportunities, that's good news, but there's a lot of challenges, there's a lot of moving parts. Have you got any views on how people, whether it's from the public perspective, the private perspective, or from a state government perspective, is there any sort of key things we need to be thinking about to address these challenges?
So, I've spent, particularly as I've been curious to learn about strategic resilience, basically not just surviving, but thriving, and what is it through adversity. I've looked at research from, let's say, Auckland on particular industries, and I've tried to incorporate it back into healthcare. I've adapted it myself. So in terms of learning over the last 30 years, I guess I've broken it down. It'd need a separate podcast, but I've broken it down into three areas. Simon, I suppose to keep it interesting, this is really at a system, or if we thought even as a healthcare system. So there's three areas. It's the values that we have and what feeds into that. It's the actions that we take, and it's our stance. So I guess within values, and this is where we try and build this in, or certainly I try and help. So leadership, situational awareness, decision making, staff engagement, innovation and creativity. They're the type of areas where you can walk the walk, demonstrate and build up and learn more about how your values translate into actions. And there are specific things that we can do. Specifically, anesthesia is all around situational awareness, actually being aware and having a plan B, a plan C, a plan D. But as with COVID, or with any area, can you pick up on things when they're not going right? And do you have people around you who will help make better decisions? Are people free to come forward? Are people emotionally intelligent, or are they ego-driven? How do we address that? How do we have open disclosure and build that trust and maintain it? We have to look after our staff. It's not an optional thing. This is, I spend my career saying we need to look after the people who are looking after our patients. It's a human business. We look after each other. How innovation and creativity and stimulating that. I think my mind was blown years ago when I started to look at becoming aware of innovation frameworks, the fact that, and this isn't taught, or it wasn't regularly taught within healthcare, how do other businesses innovate? Have they got strategic innovation processes? How do they manage that? I went over to BT and I wrote to them and I said, can I see how you innovate? And they kindly brought me over, said, look, have a look at our process. I went to Intel. I tried to learn from the airline industry. What were people doing? And then I tried to bring that back into a structured framework, because within the healthcare budgeting system, and I could talk a lot about this, but within that, really, while we talk a lot about encouraging innovation and creativity, 99% of the budget is around keeping the lights on, and 1% with a very keen eye on how it's been spent is spent on innovation. So I was able to work, and I was delighted to work with a team who were able to take some of that and expand the innovation, expand that role, and be able to deliver 10 times the value for it. That's the values. The actions, the practical actions that we can take as a system, and we might not have time to talk about this, but I'm a big believer in collaboration. That doesn't mean that we all agree with each other. We have the regulator, we have the employer, we have the colleges, but we need effective partnerships, and we need to find that piece together where we agree and where we can put our differences aside. We can break down any silos and actually work for what does better look like, and let's all focus on that. You need to know what your internal resources are. So many organizations actually don't know who are we? What capabilities do people have? And you need to be able to leverage that knowledge. So how does a system do that? And then a little bit from a stance point of view, culturally, when I talk about this, some cultures have a different view on stance. But for me, it's around unity of purpose. Are we all here? Do we have a single purpose? Are we proactive? I love a proactive stance. Rather than react, I like planning, having a planning strategy and stress testing plans. At its simplest, that's what I try and do. And any of those areas, they're all areas, and I've seen around the world that we're trying to balance this, because our learning across, particularly with the renewal. So the focus of my pieces at the moment is on strategy renewal and how we actually embrace that. But I really think as a system, I really believe in that, bringing people together, that you have to have an overall strategy, and then the strategy to execution piece, that we're clear about each element within that strategy, that we're clear about the people, the process, the technology that's going to get us there. Corporate governance at a board level, that we put investment decisions aligned with our values at the heart of corporate governance. So how will this investment decision improve that? We need to have that flexibility and encourage people to think about that rather than being stuck in a particular area, to continue to assess that in flight. So assess and adjust your portfolio as you go along so that actually you get the outcomes that you're seeking. Learn more and more about building leadership capability all around you as you adjust that portfolio. I love us, monitoring that, thinking really clearly about, are we still on track to deliver this? We need to be transparent. You know what? Together we learn fast, and we can identify then, if we get the right information, we get the right markers with the right situation, then we can learn, you know what, we have to make a correction on course here. So that helps us communicate and prioritize and explain that. And back to the word about trust at the very beginning. If we can do that, and if we do that with integrity and people understand the decision making about it, then I guess people are more likely to come with you. And for me, that's back to the virtuous cycle rather than a vicious circle of good governance. If we go back to the virtuous piece, what does good governance lead to? Well, it helps you manage conflict, because if you're making decisions, you're going to be in conflict. It helps you make collective decisions, better decisions, not just a watered down decision. And it helps you exert authority. And I've learned an awful lot over my career about trust, integrity, but also legitimacy to act in a particular situation, or for somebody to come and seek advice. So you have to act with that authority and with integrity. And that's something that can disappear very quickly.
100%. And it's interesting. A lot of people, we talk about values a lot. Values comes up a lot, but I particularly like the word stance. And, when you were talking about that, and of course, there are things like the budget, and, a lot of it goes to business as usual or keeping the lights on, I think you said. But sometimes those pieces that you can point to innovation, they can really move the dial. They can really make tremendous differences. And it brings me on to, I think really, we're definitely going to have to come back and have a part 2, because there's so much to get into here. We're not going to cover it all here today, but we definitely have to come back and discuss this, some of the topics that we've merely skimmed over at this stage. But the last thing I want to ask you today really is about, I suppose it's a bit about strategic insights for the future, but it's also because you have a unique vantage point. You took us around Africa and Auckland and Oman and various places, and you've got this unique global and local perspective. And I'm interested in sort of tallying that with your strategic insights from a global relevance perspective, because there's lots of things. You also mentioned, going out to very large corporate customers and learning how they do innovation, for example, but also that local adaptability, which is critical in healthcare strategy.
Yeah, look, they're for me, you'll hear me saying this is my mantra: everybody should be treated equally. This is a human business. It's a care business. It doesn't matter who you are, how much money you have. You should have access to the right care at the right time if you need it. So taking the two different pieces, the global, you know what, I saw that in anesthesiology. There are 5 colleges of anesthesiology worldwide who run national training programs, have exams, etc. And during COVID, for example, we came together. We're not in competition with each other. There is so much need out there for, I've mentioned the Lancet Commission findings, 95% of the world don't have access to safe surgery. We're out there and we're trying to help. Now, I am really, really conscious that if we're working with partners in low resource countries, I'm very, very conscious of not having that colonial view, but working with local adaptable needs. So global frameworks are brilliant. They have valuable insights, they're proven, but they have to be fitted into the local context. So I guess for us, when we're thinking about any new healthcare technology or policies, even say supply chain, we were thinking about supply chain here during COVID. We were thinking about having access to vaccines. Some people didn't have access to saline and water and salt. So you have to consider the specific needs, the resources. How are we going to get the vaccine to everybody who needs it? You have to engage local stakeholders from the start and have context-specific strategies. So one of the things that we did here was, let's say, women's health and young women in resource-poor countries and trauma care. So a group of clinicians here from a global health perspective were interested in looking at better outcomes for women when they were delivering babies in low resource countries where there was a high rate of death when people were having babies. So we looked at it, and you know what, you could stop and you could do nothing, because you look at it and you say, my goodness, this is going to overwhelm any resources that we have. How can we make a meaningful difference? There's only one doctor for 50,000 people. You know, how are we going to do it? So we went to colleagues in Malawi, had the highest mortality rate in maternity care. And we talked to leaders there, healthcare leaders there, and they said, we're willing. If you're willing to work with us, let's put a program together. Let's see what we can do. This took a long time. People started it in 2010. But what we've been able to do now, we've been able to train 700 people. They're not all doctors, so there are local caregivers, the equivalent of GPs, nurses, assistants, caregivers in their culture. We've been able to train them in a very short course with local material, not the high stakes robotics that we have here, on the principles and some of the very, very important things that you can do to accelerate better care in a trauma and obstetric case. So to date, we've trained 700 people, and the results are just astonishing. All that we've done is provided the environment for people to go and take the learning. It's the people who have taken the learning and put it into practice that have made the difference. When patient care, the mortality rate has improved dramatically across 2 sites where those people were trained. And it's just amazing to see that. Now that's at a very small and local level, but I guess globally, back to my point earlier on about our ambition to grow a national capability here in learning analytics. If the ultimate purpose of medical education and training is to ensure consistent or sustained delivery of high quality, safe care, then you know what, as a system, we could all do better. To the Institute of Medicine had a report in 2000. And to be honest with you, that was the first time that people started talking really about patient safety. We're talking about implementation science, but there's a long way that we can go. We can do it an awful lot better as a system on improving access to data. Does the right person have access to the right information at the right time to make a decision? What about evidence base, and how do we aggregate evidence over time? Do we take into account those local needs and the context? And how do we address barriers? And on a daily basis, your heart could be broken with overreach from different areas, and people missing that view sometimes about what is it that we can do together to make this better. Not necessarily make everybody work more and more. What can we do to focus our energy? And together, I would love a shift to a system outcome. I would love, instead of us saying, as a health system, we need to recruit 5,000 more people next year, that we started looking at outcomes in a different way, that we started looking at even for retention, strategic workforce planning. I'd love to see us measuring from a training point of view how many people are in post 10 years after doctors are in post. We train doctors to become consultants. So how many are in post 10 years later on and are happy in what they're doing, and that their colleagues would say they're contributing positively to the department? That to me is far more meaningful for that person, for the patients, for their colleagues, than saying how many people got an exam last year. That's the wrong thing to measure. So definitely, I'd love to see a shift more to looking at systems outcome, and to that end, definitely we're pushing the envelope a little bit on that. We got a number of people to come together, regulators, international healthcare providers, European, Australian, Canadian experts, and we formed a consensus statement on the outcomes of training using a logic model. So that's where I see we'll be putting more focus into trying to get us all to work together, to have the right data at the right time, improve learner performance along the way. Nobody goes into work to do a bad job. And what we're here for is patient safety and trying to improve care.
And that's a wonderful thing to leave this part of our discussion on. We're going to have to come back and do a little bit more, Martin, but what a great sort of thing to leave us with, to think about and to consider. Love the outcomes focused approach too. Look, it brings us to the end of today's show with Martin McCormack. I want to thank everybody who's watching or listening to this episode around the world. Make sure that you tune in again to see and or listen to the next VistaTalks show, where we'll be discussing more interesting topics with interesting people from all around the world, just like Martin. But Martin, thank you so much indeed for your time today. It's been a fascinating discussion, and I'm already looking forward to catching up with you again. So thank you, Martin. It's a pleasure.
It's a pleasure, Simon. Thank you.